In preparation for what I'm going to try to explain to you what happened to baby N, failed intubation issue on a hemophiliac baby. I did a little research, and I remember a case that has garnered a lot of let's just say attention, that is worldwide attention, and perfectly examples what should have been done. And her name is Elaine Bromley. Happened in the United Kingdom. Basically, came in a healthy 30-something-year-old mother of two that went in for kind of a routine, no big dealish sinus surgery. What happens is that um, when she was anesthetized, things went wrong. Okay, as it can happen with anesthesia, and no one took real charge of the situation. They all stayed in their own box, if you were to say. There was three consultants that was there. I think it was the ENT, anesthetist or anesthesiologist, and I think it might have been a third one. Noticed the thing was going on. And instead, they were only thinking in their own box and not thinking of the wider view. She had gone quite a long time without adequate oxygenation, and no one thought, they were trying to intubate her in order to do the surgery. No one thought to do a tracheostomy, except for the nurses. The nurses came in knowing there was an emergency situation. Three of them came in. One came in, brought in a tracheostomy tray to do that. The consultants absolutely looked at her and didn't care because, of course, she was just a nurse. The second nurse went out, called the intensive care unit, got a bed available for her. Came in, told the consultants, they told her to cancel it. And I don't know what happened to the third one. Now, obviously, they just decided they would just not do the procedure and just let her wake up normally. Well, she never woke up and had severe brain damage and had to be taken off life support and eventually died, leaving two young kids. Now, her husband was incredible. What he was an airline pilot. And what he did was he decided they did an inquest, and this was back in 2006, and did kind of a post-mortem on the situation, a root cause analysis. And he did it as an airline pilot. And if you always remember that airline pilots, when there's a crash, there's not a whole lot of crashes of planes, considering there's so many planes in the sky. Very, very, very few of them crash. And what they always do is they do some sort of like a root cause analysis on it without blame, trying to figure out where the weak link in the chain was, per se. And what they found out with her case is that no one was allowed to take charge and say stop. There was a certain hierarchy. And again, if the nurses were allowed to say stop, do a tracheostomy, things would have changed. Now I'm going to use, no one did what we would call a kind of a timeout situation to make sure that everything was fine. And again, no one took the time to do a real quick risk when it came to baby N. First of all, why was baby N there? It was a 34-weeker with intrauterine growth restriction, so it was much, much smaller than it should be, with a known fact that the mother was hemophiliac carrier, and they knew that was. And they got surprised when this baby started to have a bleeding. Again, everyone panicked. It took multiple attempts to intubate this baby. They even overdosed it on morphine. And of course, Brewery was there, and he just, didn't believe anyone. So, and this baby ends up, the child has some difficulty, I'm assuming some sort of a brain damage afterwards. It's not as severe as baby G, but it's enough to the point where mom is so afraid and wants to be so protected of this baby, who's now a child. She doesn't homeschool it just because she believes in homeschooling, and part of that movement she does it. She wants to 100% protect this child, which is sad. Now, I'm going to use my example. I just had a routine colonoscopy a little over a week ago. Everything turned out fine, and the reason it turned out fine was for the following. First of all, I was screened prior to even even having this procedure done weeks in advance, I had a call from someone, and they, first of all, they asked me if there was any anesthesia issues, and I was already flagged in my chart. And the reason I was flagged for issues is that you can tell I have kind of a turned up nose, and I have a I have a very tiny mouth, even though technically I have a big mouth, but I have a very, very tiny jaw. My jaw is smaller than the average person, and I have a very small mouth, very crowded teeth and such. So I am a risk for intubation, meaning they just have to do just a little extra to me in order to intubate me. So they said, no, you cannot have this routine colonoscopy at what we would call a surgery center with just a nurse anesthetist. Yes, you can have your anesthesia with a nurse anesthetist, but you have to go to a place, you have to go to the outpatient place in a hospital where there's an anesthesia in the anesthesiologist, a physician in that, just in case there's an emergency. So I went and had it done. Obviously, they do all the checklist things to put my band on me, and they rolled me in and asked all the requirement. The anesthesiologist even came by just to make sure that I was a good risk for anesthesia. Walked into the room, and they did something what they call as a timeout. Okay? A timeout, and this was developed by airline pilots. Okay? That's why we don't have that many crashes, is because they do that checklist. And they do a certain checklist. Again, they do a checklist in the cockpit, but they do a checklist prior to that plane even going. They do the external checklist. And with the checklist involved, for me, it was just basically they rolled me into them. I had to show them my bracelet, who I was with my name on it. I had to tell them who I was and my birth date. And everyone had to agree that I was who I was. And then they all introduced themselves, basically, not only to me, but more importantly to each other. There was 4 people in that room. It was, first of all, it was the nurse, and he basically said, yes, I agree. On this piece of paper here, it says my name and my birth date. And he says, I have a signed consent for, and said what that procedure was, what that type of colonoscopy was. Then the assistant to the technician who was going to help the doctor deal with the dreaded instrument said who she was, and then what she was going to do. That a nurse anesthetist said who she was and what she was going to do and what medication she was going to give me. The doctor then said who he was and what the procedure was. All 4 of them had to agree that everything what they said was correct. This took all of 30 seconds. And then they all said goodnight to me. And I didn't even need to be intubated or anything. They gave me something called propofol, which is like, I call it the propofol nap. It's fun. Now, Elaine Bromley's husband, that was that lady that had that, but died. He was an airline pilot. Again, what he did is he had them do the root cause analysis exactly like it was a crash of an airline. And as he says, and when he gives lectures, and he's been known to give lectures in medical schools, he says, I am happy to say that all of those doctors and nurses that was involved in this incident are back to work because they learned by their mistakes, and they can say their mistakes, and they owned up to their mistakes, and they're using it as a learning tool. So again, had there just been that type of a root cause analysis on each one of these babies, they would have been able to figure out what was the problem, what happened, and how can we make sure it doesn't happen in the future. Now, let me tell you about the story of why the checklist for airline pilots was started. It was started in World War II, at the very beginning of World War II, as we Americans were preparing and building up our armaments, building up all the airplanes and doing all that stuff. It happened because of, I think it was basically somewhat of a new type of airplane, and it was a test pilot that had it. The best test pilot in America was doing a test pilot on this plane. Back then, they didn't do any kind of a checklist. Again, he was the best thing. He thought everything was perfect. He just took off. That plane crashed. All of his friends knew that he was the best airplane pilot that they've ever met. It hit them so bad. That's when they developed the checklist for airline pilots. Now, it took a long time for let's just say the medical community, and it happened in the early 2000s, for them to realize we need to do that type of a timeout for that. And the reason that was developed was because we were doing surgeries. What? We were amputating the wrong leg, doing this, doing that, and that has decreased medical problems tremendously, except for those that don't take that few seconds to stop and think. And allowing each team member, no matter what their rank is, to say stop, not as a way of shall we say being a bully, but it's a way to say I'm not confident here. And this, again, when we get into the baby end, we're going to realize all the mistakes that were done on this. That was just so sad. Again, we know that these type of things should happen. That you got to stop, think. Everyone in that team is just as important as the next person, no matter what their rank is. And we have to let everyone have the ability to say, stop, I'm not comfortable. And then when mistakes are made, to own up to it and to be willing to then learn from the mistakes and make sure it doesn't happen again. It's the cover up that causes all the problems. I had the best nap I ever had the other week after I had my colonoscopy, and I had great results of the colonoscopy. The doctor says, guess what? I don't get to see you for a lot of years. Everything looked great. Sad thing is this baby and all those babies, had there just been a quick timeout, what's going on? What do we need to do? Again, people were seeing various things with various things. They did not have the ability to say, wait. Let's use baby A as an example. But even before that baby crashed, even before Lucy ended up and entered that room, that baby was having issues. There was a nurse that pointed out to Dr. Hawkness, wait, something's going on here. Did he stop? Did he evaluate the situation? No. He just allowed the nurses who were unaware that this was happening. Again, Melanie Taylor and then Lucy Letby came in a little bit later and started those IV fluids, and that's when things happened. Had he listened to that nurse had said, wait, there's something going on here. Could it be the line? That baby might be alive today. Again, kind of sad. Again, with Lane Bromley, the nurses rolled in a tracheostomy tray. They didn't listen to her. They didn't stop. A nurse called and to make sure that there was a bed in the ICU. The doctors forced her to cancel that bed. That was back in 2006. And I just the strength of that husband to say, let's reevaluate this, has lost his wife and has had to raise 2 children on his own, for him to say, let's stop, let's reevaluate this, as if it was an airline crash, to make sure it doesn't happen again. And the sad thing is that it did happen again. And Lucy was put in prison when she never even crashed that plane. It was those consultants, along with the NHS, and all the stuff that they knew that they needed to do prior to those babies even being conceived, such as that building maintenance. You have dead babies. Bye-bye.